Dr. Dawkins here from our Aventura location. Today we're going to discuss your thoracic spine, and I'm going to show you about 3 exercises / stretches that you can do to help relieve tightness. So the thoracic spine is between your cervical spine and your lumbar spine. Typical patients I see with thoracic spine tightness or stiffness or pain are workers who either sit at a desk all day, or they are bending over like a dental assistant, they're in someone's mouth all day. They experience tightness mainly behind the shoulder blades and at the base of the neck. You may see some people with a hunch, or you call it a kyphosis. A lot of the times that's due to prolonged sitting and in that one position over your keyboard. So today we're going to show you some things to help reverse and correct that bad posture. The first stretch we're going to do just requires a wall or a countertop. You can use either or. I'll demonstrate both of them. So the wall version, you take your hands, put them on the wall about shoulder width apart. You get in an athletic stance, so feet shoulder width, knees slightly bent. What we're going to do is dip our chest down, trying to get parallel. Hold that for about 15 seconds, come up, and then do it again. Done correctly, you'll feel a stretch all the way down your mid to almost lower back. The counter version, similar, athletic stance, knees slightly bent, and you're gonna force your chest down towards the floor, and coming back up and repeating that about 5 times. So you can do 5 sets of 15 seconds. These are great stretches for that mid back to release some of that tension. For our next thoracic mobility exercise, we're gonna have our patient, Dimitri, he's gonna lay on his back. This is a foam roller he's gonna lay on. And so the goal with this is to open up the chest and open up the thoracic spine, the upper back. So the pectoralis muscles act as an antagonist, or they work against the back muscles. So we need those to be stressed out, open too, to allow for our back to actually have some mobility. If not, we're just gonna be like this all the time. So what Dimitri is going to show you right now is a couple different variations of how to actually lay on this. So the first one, he's just going to have his arms wide like that, giving that stretch, opening up the chest a little bit. A couple of his personal favorites are behind the head, his hands behind the head. By doing this, we are forcibly opening the chest and actively getting a stretch. And then the last one I like is for him to hug himself. This is moving the shoulder blades out from the center to the side, and that way he can actually even rock a little bit from side to side to actually get rid of any adhesions or knots in that upper back area. This is, I like to call it the thoracic opener. So Dimitri's going to start with his right hand behind his head, behind his neck, and keeping his pelvis as straight as possible, in line as possible. He's going to rotate and try to look towards the ceiling. There we go. Hold that for a couple seconds and then go back down. He'll probably do it for about 5 sets on each side. And this is, once again, just trying to open up that thoracic spine and allow for a little more movement and less pain and muscle adhesions. Dimitri's been doing this for a while, so he's good. A lot of people don't get discouraged. You can't go up as far as he can. Those were a few stretches to help with your mid-back or upper back pain from sitting at a desk alone or whatever causes it. If you come into the office, we can obviously do some more hands-on and show you a few more exercises that you can do to prevent this discomfort.